For many patients with rare diseases, seeing their doctor often requires traveling to a different state and presents a significant barrier to receiving care. I'll tell you a quick story about a child named Georgia, 6-year-old girl from New Hampshire. When she was just a few weeks old, she needed surgery to correct a chronic intestinal pseudo-obstruction. Her local hospital could not perform the surgery, but thankfully, New Hampshire had a long-standing partnership with Boston Children's Hospital. Thanks to that collaboration, she received the care that she needed when she needed it. But other children are not as fortunate. In another state without access to advanced medical care, a 1-year-old with a rare complex congenital heart disease is racing against the clock to find treatment. Her anatomy is determined to be too complex for surgery close to her home. Boston Children's Hospital is ready to receive her, but first her surgeons must go through hurdles to enroll her in the home state's Medicaid program in order to get the authorization to provide care. Right now, she and her family are still waiting in a children's hospital in her home state, hoping the paperwork goes through in time to transfer her to Boston and save her life. Dr. Bozek, have you had patients and families in your care while they waited to access expertise outside their state or insurance network? And could you describe how that wait impacted their health?
We absolutely have had that in our state. We've had it both ways. Patients who want to come be seen by us, who have unnecessary hurdles thrown up, and vice versa. Although, since I'm the chair of the department, I want to say that all kids in Iowa should come to the University of Iowa, and we certainly welcome them if it's the best place. But in point of fact, I can give you one example where somebody was really very far. It's a pretty big state, and they had a much closer children's hospital and they had very severe kidney disease, and they were left with, they were told that they couldn't go to the other children's hospital, and this patient ended up getting so sick that the family actually had, at a lot of expense to them, had to move closer to our hospital just because now she went from not needing dialysis to needing dialysis multiple times a week. And I asked my faculty, anticipating this hearing, to give me cases. I have 2 pages of such cases, so yeah. It is an absolutely huge problem.